Hi, my name is Rachel Moran. I'm from Men's Mastermind Exercise and Nutrition Doing, and we're dedicated to tackling obesity. About 25 or so of the London obesity have already used our programmes quite successfully. The question is around governance, really. It's been touched on a few times, and I just wondered about the panel's view on whether we can really dent obesity in London with a continued focus on largely working at borough level, and whether more should be done to legislate for more collaborative working, for example, across PCT boundaries.
Yeah, whether we want to take the strategic question,
I'm happy to start. I think the answer to that has to be yes in theory. How we make that work in practice, I think, is more difficult. But we do have an awful lot of organisations in London doing PCTs and budgets. It's been really encouraging the several PCTs done health checks on the local authorities, their local area agreements. I think more than 20 of them have now actually signed up to make obesity a priority, which is fantastic. But we do risk having a lot of losing the benefit of synergy and the So if we can find ways of bringing that together without over-bureaucratising it, it's a challenge. We have to keep going back to elections to everything to get approval to do stuff, then it can be a little bit. But if it can be enabled and it's carried out way of bringing it together and you can actually get that right, then I think it's time.
Yeah, I mean, I would agree with that. It's very different. But I do think there is a need for certain kinds of legislation to look at. Sorry, you did have to change law, and that can become a very important thing, and it does take a very long time to work through the boroughs, as we find in terms of any of the initiatives that we run through the local food board. In some boroughs they work brilliantly, in other boroughs they have absolutely zero impact whatsoever. You might as well not exist, actually. So it's slower than we would like.
Can I perhaps ask someone in the audience to make a comment about what is happening in the local partnerships? Because I know that the plans team has been looking at the extent to which local authorities and PCTs are working together. Would you be able to say something more about that?
Just actually some of our findings sort of fed into Lindsay's presentation. Regional Public Health Group, regional arm of Department of Health, surveyed all PCT local borough partnerships. Over 20 have shouted obesity as priorities. Half of them have strategies we recognise as building on good practice and national policy. The other half are actually actively working with their partners to take it forward. The big risk is the small projects and the financial position moving forward. So, another thing in the sense of what we're finding is sort of contradicting what members of the audience or the panel are saying. What we're trying to do with the leads in those partnerships is now work with them and say, what support do you need in the regional tier to move forward strategically without cutting across the fantastic things you are doing. So we're in open dialogue with them. It's fantastic that the panel and the two cities are working. So we're open to that sort of dialogue with people and people in the audience sort of approaches, to come forward with some suggestions. But we do get faced with huge amounts of complexity, huge amounts of people advocating one solution to a multi-standard problem, and therefore we're just spending the next few weeks just working that through.
Yes. But talk, I've got a loud voice. Alex Bax, former health advisor today now, lucky enough to be part of the study group. One issue which I'm not sure has come through that strongly here is the vital importance of very, very early years. The fact that obesity seems to be triggered of being laid down even from 0 to 1 is a key time in a child's life. And therefore the food culture of families is extremely important. But a few people have touched on this. We haven't really heard very much about how to address that, which is a very sensitive time when a young child is in a family, possibly a time for change, and therefore a time when perhaps agencies can get around and support change in food culture in families. Lindsay mentioned breastfeeding as one thing, but perhaps there are some other things we can do. Breastfeeding alone, while a good thing, may not do enough. So any thoughts for the plan about that 0 to 1, very, very early years group?